Chapter 28, Therapeutic Agents for the Hematological System. We'll skip the terms and definitions for now, but we will go through them throughout this lecture video. In the beginning of the chapter, we have the common drugs for conditions of the hematological system with their pronunciation. So a good thing to practice. Blood flow is critical to delivering oxygen and nutrients to the body's tissues and organs. Not only does the blood carry oxygen and nutrients throughout the body, it also carries waste from the tissues and organs that it supports to organs such as the kidneys and liver for elimination. The blood also transports immune system cells to sites of infection and injury. Whole blood includes plasma and cellular components. Plasma is the fluid component of whole blood that includes water, plasma proteins, and other solutes such as electrolytes and nutrients. It accounts for approximately 50% of whole blood volume in a normal, healthy adult. Serum used for laboratory tests is plasma that has been allowed to clot in the laboratory to remove clotting factors that can interfere with some blood tests. Various plasma proteins are present in the blood, such as albumin, globulins, fibrinogen, and prothrombin. Albumin is critical for maintaining water and solute balance in the blood. It's a large protein that cannot diffuse across vascular epithelium, as do water and electrolytes. Another important function of this is to serve as a carrier molecule for blood components and drugs. Fentoin is an example of a drug that is highly bound to albumin. Its use with other drugs that bind to albumin can lead to Fentoin toxicity. We can use intravenous albumin to increase plasma volume or to increase albumin levels in people with low serum albumin levels. Two primary forces regulate the movement of fluids and solutes into and out of the vasculature: hydrostatic pressure and osmosis. Albumin is the major blood protein that maintains osmotic pressure in the vascular system. In certain cases, people can produce less albumin or lose albumin from the bloodstream. When this happens, osmotic pressure decreases, leading to the fluid accumulation and edema. Platelets, also known as thrombocytes, are blood components essential to coagulation. Because platelets are vital to clotting, low platelet levels, thrombocytopenia, can increase bleeding risk. A lifespan of a platelet is about 10 days. We can divide the cell types into two main groups: leukocytes and erythrocytes. Leukocytes are white blood cells, immune system cells that help to defend the body against infection. Some examples of leukocytes are lymphocytes, neutrophils, and monocytes. Erythrocytes, or red blood cells, are the most prevalent cells in our blood. Their function is to carry oxygen to the tissues and organs. Erythropoiesis is red blood cell production. It takes place in the bone marrow, and the hormone erythropoietin largely drives it. Red blood cells can effectively transfer oxygen because they contain hemoglobin. Hemoglobin is an oxygen-carrying red blood cell protein that binds to oxygen as blood passes through the lungs. Anemia. So anemia is a reduction in the total red blood cell number available to carry oxygen, or a deficiency in the quality or quantity of hemoglobin present in red blood cells. Table 28.1 lists the classifications of anemia. Anemia of chronic inflammation is increased demand for erythrocyte production. Pernicious anemia is vitamin B12 deficiency due to congenital or acquired deficiency or intrinsic factor. And here's all the other different types of anemia and their cause and or contributing factors. Iron deficiency anemia is the most common worldwide. Iron deficiency symptoms include fatigue, weakness, shortness of breath, and pallor. People at risk for iron deficiency are children, women of childbearing age, and people living in poverty. And we have iron preparations for the treatment of iron deficiency anemia. That's table 28.2. We have ferrous sulfate, very common. You can buy this over the counter. It also is sometimes covered by insurance or cheaper to get through the pharmacy. We also have ferrous gluconate, which is over the counter, ferrous fumarate, and iron polysaccharide. We have parenteral iron like iron dextran, ferric gluconate, and iron sucrose. So here's our over-the-counter ferrous sulfate. A lot of patients will get a prescription sent in, and it might be cheaper for them to purchase over-the-counter depending on the pharmacy that you work at. So you might have to show them where that is. Polycythemia is excessive red blood cell production. People can develop either primary or secondary polycythemia. Secondary polycythemia, the most common form, occurs as a result of a physiological response to hypoxia. Primary polycythemia, also known as polycythemia vera, is a chronic condition of RBC overproduction. This overproduction is due to an increased sensitivity of stem cells in the bone marrow to the effects of erythropoietin. For those with polycythemia vera, the prognosis can be poor if the person does not receive appropriate treatment. However, with proper treatment, survival can last from 10 to 15 years. Drug therapy in polycythemia vera includes treatments aimed at minimizing thrombosis risk with myelosuppressive agents. The medication hydroxia, it is indicated for polycythemia vera. And it is actually approved for off-label use for polycythemia, meaning the FDA hasn't necessarily approved it for this indication. A variety of conditions and secondary factors can contribute to impaired hematopoiesis, resulting in conditions such as thrombocytopenia, leukopenia, and neutropenia. Agents known broadly as colony-stimulating factors can stimulate hematopoiesis and treat such conditions. Thrombocytopenia is a term that describes low platelet count. It has many causes. Some of the most common causes are pregnancy, drug side effects, and idiopathic thrombocytopenia. The principal treatment goal is bleeding prevention. Box 28.1 lists select drugs frequently associated with drug-induced thrombocytopenia. Individuals with particularly low platelet counts may need transfusions to increase platelet levels. Severe thrombocytopenia may necessitate activity restrictions such as limiting contact sports. Neutropenia can occur in conjunction with other conditions, during chemotherapy treatment, and as an isolated condition. To assess a patient for neutropenia, the absolute neutrophil count classifies the neutropenia as mild, moderate, or severe. So we have the medication Neupogen that is indicated for neutropenia due to chemotherapy, bone marrow transplantation, and hematopoietic radiation injury. So it's a subcutaneous injection that they give at home. So you will see this in the retail world. And we have the medication that is intravenous and subcutaneous leukeine. Leukemia is a cancer characterized by cancerous hematopoietic cell production that replaces normal white blood cells in the bone marrow. Environmental factors can include exposure to radiation and chemicals, including radiation and chemotherapeutic agents used to treat others with cancer. Table 28.4 lists select chemotherapeutic agents used in the treatment of hematological cancers. We have alkylating agents, purine nucleoside analogs, pyrimidine analog, monoclonal antibodies, anthracyclines, idomycin. We have the class topoisomerase 2 inhibitors. We have vinca alkaloids. We have tyrosine kinase inhibitors. We have retinoic acid derivatives, antimetabolites. Antimetabolites are for leukemia. One popular antimetabolite is methotrexate. That is something that you will work with in both aspects of pharmacy. Antibiotics for cancer are in different categories than those for infection. These chemotherapeutic antibiotics bind directly to cancer cell DNA and prevent new cancer cell development. We do not use these agents for infections because of toxic side effects, because they also destroy normal cells with cancer cells. They produce side effects that include severe vomiting, nausea, diarrhea, and hair loss. So some examples are bleomycin, doxorubicin. Mitotic inhibitors prevent mitosis at the metaphase stage. Mitosis is the process of cell division that all cells must perform. The agents that prevent this cellular reproduction are a group of plant-derived alkaloids. Hodgkin's disease and various cancers that may not respond to other medications often require treatment with mitotic inhibitors. The two major types of alkylating agents are the nitrogen mustards and nitrosoureas. Although similar in structure, their modes of action and side effects differ. Nitrogen mustards represent some of the first chemotherapeutic cancer agents. World War I saw their use in chemical warfare. Soldiers exposed to these agents had a reduced number of white blood cells. Because of this effect on white blood cells, they were used to treat leukemia, which is marked by a high white blood cell count. Although effective, the first nitrogen mustard had severe side effects. They have been replaced with agents derived from the same chemical structure but better tolerated. Side effects may include low blood counts, nausea, vomiting, mouth sores, hair loss, darkening of veins used for infusion, and fertility loss. Nitrosoureas can cross the blood-brain barrier that surrounds the central nervous system. As such, they can affect brain cancer. Side effects may include nausea, vomiting, intense skin flushing, red eyes, headache, and rash. Anti-androgens are part of prostate cancer treatment, also known as immunotherapy. Biological therapy is a type of cancer treatment that uses natural or laboratory substances. Lymphoma, as the name suggests, are cancers of the lymphatic system. They initially develop in the lymph nodes or spleen. The inflammation-associated lymphoma development often leads to enlarged lymph nodes, which can be an early cancer symptom. The prognosis for lymphoma varies widely based on the type and stage, as all cancers do. Table 28.5 lists the stage of cancer. Stage 1 means that the tumor is located in one part of the body. It's very treatable, small and localized. Stage 2 is slightly more serious than stage 1. The tumors are larger, but they have not spread to surrounding tissue and lymph nodes. Stage 3 has begun to move from the local organ to the surrounding lymph nodes. And stage 4 is metastatic cancer, the most advanced form of cancer. This type of cancer is characterized by large tumors that have spread to surrounding organs. After cancer has metastasized, it generally cannot be completely removed by surgery. A defect in one or more clotting factors involved in the coagulation process can lead to bleeding disorders. Bleeding disorders can be drug-induced, genetic, like hemophilia or von Willebrand disease, or due to other disease processes, like liver disease or vasculitis. Drug-induced bleeding is relatively common with antiplatelet agents, anticoagulants, and NSAIDs. Hemophilia is a hereditary coagulation disorder associated with intermittent bleeding episodes. Hemophilia ties to either a deficiency or lack of either anti-hemophilic factor 8, known as hemophilia A, or factor IX. Hemophilia treatment involves prophylactic blood infusions or the use of recombinant factor 8 or factor IX products. Von Willebrand disease is the most common inherited coagulation disorder and is associated with decreased activity of von Willebrand factor. Von Willebrand factor facilitates platelet binding in the vasculature. We have the medication DDAVP. It is indicated for bleeding prophylaxis, hemophilia A, hemorrhage, surgical bleeding, von Willebrand disease, diabetes insipidus, and nocturia. So this medication is actually commonly prescribed for children that are bedwetters as well. They did put nocturia, so nighttime urinating. Routes of administration can be intravenous. That's going to be for your more specific bleeding disorders like hemophilia or hemorrhage or surgical bleeding. The one that I'm talking about is either going to be oral or intranasal. And remember, the following sound alike look-alike drugs: Coumadin versus Cardura, Neulasta versus Lunesta, and Neupogen versus Numega.